Hello, everyone. Good morning, and it's lovely to have you here. Welcome to Shot at Life's Mobilize to Immunize 2022 Summit. My name is Maxie, and I'm the Director of Grassroots Advocacy at the United Nations Foundation. We are so excited to have you all today. So as you trickle in, I just want to say welcome. So whether this is your first summit or your 10th summit, we are so excited to have you here. And joining us today, we have more than 32 states represented, and of course, DC and some of our and some international champions. We also have some of our great partner groups, including AANP, NAPNAP, GFWC, SNAFA, Nurses Who Vaccinate, UNA USA, among others. So if you don't know all those acronyms, you might learn them by the end of today. But if you are part of one of those groups, thank you for joining us. And if you're not part of one of those groups, we're so excited to have you here, and we look forward to connecting you with other champions. So I'm going to give you just a couple quick tips before we jump into the day. One, if you are not using a Chrome browser, we highly recommend that you do that. It'll make things work seamlessly for you throughout the day. If you have any issues, we have found that usually just refreshing the page or re-entering the event has fixed a lot of those. And of course, making sure other big applications are closed will help you out as well. If you have any questions throughout the day, if it's relating to the campaign, you can always feel free to reach out to us at champions@shotatlife.org. And we're happy to step in and help. If you're having any issues with the platform itself with Hopin, I encourage you to go to the Expo. There will Expo section. There will be a help desk there available for folks if you have any issues on the tech side. So of course you have a couple different resources you can reach out to. There's also ways to connect with other champions throughout the day. We really encourage you to reach out to other folks. There are breaks built in throughout. So if you'd like to utilize one of those breaks to connect with other champions, we encourage that. But we do also want you to take those breaks. We understand that you're taking a day out of your life. So, please engage with us as best you can. We understand that there will be spouses and children and animals running along, and that's totally fine. We're just so excited to have you here. So we encourage you, you'll see on the agenda, there are multiple sessions and breakouts throughout the day. And really, to get the most out of these sessions, we're encouraging folks to come on camera when you've got questions. There will be plenty of conversations, and we really want this to be as interactive as possible. A lot of our champions are part of the content because we know that there's a wealth of information from our current champions, our new champions, our advocates from all over the country really have such an expertise on this now. So you're not just going to be hearing from us at staff, you really will be hearing a lot from other fellow champions. So as those breakouts come up, we've categorized them in different ways. So you can connect with a variety of champions, but they are self-selected. So please go into whichever group you would like to for any of those breakouts. The more you put into this, the more we'll all get out of it. So I encourage you to not be shy, hop on camera when you're asking questions. Our team is so excited to engage with you. And I know a lot of champions miss getting to hang out with each other. So I encourage you to do that, to pick your breakouts. There's also going to be a fun one later in the day that's based on, it's a personality quiz because we wanted you to have a chance to meet with a variety of champions. So there should be a quiz in the chat that you can take at some point throughout the day, or just pick which animal you like the best. So we encourage you to, really engage in these discussions. We'd love to hear from you before, during, and after this summit, especially as we move into this period of Mobilize to Immunize. So please, keep that in mind. And then lastly, we wanted to do a quick announcement that we will announce throughout the day, but we are fortunate we will be back in person for our spring summit. So we've missed you for a few years. I know we're excited to see some of our champions in person. This month, we'll be releasing the date and opening up applications for that next month. So we look forward to having some of our champions back in DC in the spring. So something to look forward to. And if you have any questions, as I said, throughout the day, please engage with us. And if you're just joining or you miss some portions throughout the day, anything that's on the stage will be in the replay section. So we encourage you to check that out. We will not be recording sessions because we'd love for you to feel as comfortable as possible discussing, anything that comes up. So the sessions will not be recorded, but the stage items will be, and we will have those available for you as well. So without any further ado, I would love to introduce Martha Rebour, the Executive Director of the Shot at Life campaign.
Excellent. Thank you so much, Rebecca. Big welcome to all of you. Thank you so much for signing up and tuning in today. It has been a crazy couple of years. We have so missed seeing you and gathering in person, and we're so grateful for your support. And I know you all have very busy schedules, so thank you for taking the time today to be with us. As Rebecca said, we have built-in breaks. We understand some of you may need to be following up on email or doing other things, so that's fine. And rest assured, though, your time today will be very well spent. The team has put together a really great program for you. And then in the spring, we encourage you to sign up for our spring summit, where we'll be able to see many of you in person. But I think you'll find there is great content today, and this will be worth your time. So I'm going to take you through a little bit back to our origin story. I know some of you are quite familiar with it. You've been with the campaign for a while, but I think reminders are good sometimes. And I know some of you are new to Shot at Life. So to talk about exactly what we are, we're an organization at the bottom of it that ensures people around the world, especially children, have access to life-saving vaccines, or a shot at life, which is in our name. So on this slide, hoping some of you recognize these faces, although obviously this photo was taken from a long time ago. The first story, the origin story I'm going to tell you about today, is about Bill and Melinda Gates. In 1993, Bill and Melinda traveled to Africa for a vacation to see animals. In fact, what they encountered was the first time they had seen extreme poverty, and this really had a profound impact on them. So when they returned from that trip, they did a lot of research, and they read and learned that millions of children in Africa were dying every year from diseases that nobody dies from in the US. And we're talking about hepatitis B, yellow fever. Rotavirus alone was killing 500,000 children a year in Africa. So they returned to Africa, this time to better understand the drivers of poverty and how to save children. And they soon realized that the very best way to prevent so many children from dying from these diseases is to increase access to the vaccines we all are able to get here in wealthier countries. So this is vaccines against measles, polio, pneumonia, diarrheal diseases, among many others. So they started a large-scale global effort to commit their own resources, but also to spur investments by others, and for this to be these to be catalytic investments. So whether it's governments, other NGOs, and it's especially national governments. They launched our organization, Shot at Life, and the model is what we call grassroots advocacy. So we work with advocates such as yourselves and give you information and training so that you then reach out to your policymakers, so that when they're appropriating funds, and Brian's going to fill you in a lot more of the details of this later today, but the funding that goes towards the UN, our UN partners, UNICEF and WHO, as well as Gavi, the Vaccine Alliance, when those appropriations go through, we're ensuring that they are robustly funded. So how do we make an impact? So as I said, we train volunteers such as yourselves. You reach out to your policymakers, explain to them why these investments are so important to you and have such a good return on investment. We also partner with other organizations. So we partner with companies, we partner with UN partners in the field, UNICEF and WHO. And all of this results in millions of children being protected from deadly diseases. Now, one of our biggest partners for the past almost 10 years now has been with Walgreens Boots Alliance. So I'd like to play you a little video and then talk a little bit about that partnership.
When is your flu shot more than a flu shot? When it helps give a life-saving vaccine to a child in need in a developing country. Thanks to customers like you, Walgreens' Get a Shot, Give a Shot program has helped provide 7 million vaccines. Make your flu shot make a world of difference. Walgreens, at the corner of happy and healthy.
So many of you probably noticed that video was back from 2016. I'm not sure if you recognize the voice. That was Tina Fey. But I can tell you back then it was 7 million. Now they've provided more than 70 million vaccines to help protect children around the world. And Walgreens has committed to provide 100 million measles and polio vaccines to protect children around the world by 2024. And we are on track to do that. We've been recognized by the U.S. Chamber of Commerce. This is a great program. And I know many of you have participated and many of you go to Walgreens to get your flu shot. So I wanted to thank those of you who have done that. And if some of you have not gotten your flu shot yet, I would just give a little encouragement maybe to go to Walgreens if you choose to do your flu shot. So this next slide, again, we all know that vaccines save lives, okay? Over the past 20 years, as a community, we have made incredible gains. This chart, I hope it's showing large enough so that you can read it, but if you look at deaths in 1990 versus deaths in 2019, we sort of call this the magic of vaccines slide, because if you look, the millions of deaths that were prevented because of vaccines, it's incredible. So we made all this progress. We came together as a global community. And then, as we all know, there was a very dramatic event that happened a couple years ago, which is the pandemic. Unfortunately, what the COVID-19 pandemic did is it really put child immunization progress at risk. And it's put millions of children at risk of disease. You can see there in many cases, there were health systems that were struggling already to reach children. And suddenly they have to vaccinate adults. You know, they have to vaccinate against COVID. So we realize vaccines are one of the most cost-effective ways, but without strong support, we are seeing diseases already. And if you look at this chart about measles cases, the first dose of vaccine protecting against measles dropped down to only 81%, which is the lowest level it's been at since 2008. This is leaving 24.7 million children vulnerable. And as we all know, measles is often what they call the canary in the coal mine. When there are problems, when children are not protected against measles, that means there's weaknesses in the health system. Measles is incredibly contagious, and we know that there will be outbreaks. And you'll hear from our colleagues at UNF's Global Health Department a little bit later today about some of these outbreaks and about what we're seeing. Now, the good news is that we have the tools and the innovation and the know-how to get back to where we were before much more quickly. It won't take us 20 years this time. But we need to dig in, and we really need to all roll up our sleeves. We need to make sure our policymakers understand. Some people are saying, I'm tired of hearing about vaccines, infectious disease. We can't afford to lean back right now. We need to lean forward. We all need to be strong advocates because we are seeing cases increase. So now I'd like to show you a video that was put together by the WHO, and it's a little bit about the pandemic, and it's introducing Immunization Agenda 2030, which again, you'll hear a little bit more about later today. Let me roll the video first.
When COVID-19 hit, where you were in the world determined the course of your life thereafter. How quickly your government reacted, how easily you accessed healthcare, whether you could work or go to school, lost loved ones, kept connected, stayed alive. Science found solutions, yet the biggest vaccine rollout in human history has also revealed the long-standing inequities facing humanity. Across all vaccinations, all diseases, all pathogens, and all countries. These inequities won't end until we close the gap. Until the vaccine divide is closed. And the knock-on effects of inequitable access to primary healthcare and technology stop posing dire and dangerous threats on both our lives and our livelihoods. The power to close the vaccine gap lies with all of us. So what are the decisions we need to be making? Keep vaccinating to reach our targets. Keep building production capacities. Keep preparing for the worst and keep strengthening for the future. Failure to fund, support, lead and prioritize primary healthcare is a dangerous risk we cannot afford to take. The future will arrive, more disasters will strike, and right now is the only chance we have to make sure we're ready. Together.
So as I said, if you're interested, you can certainly go to ia2030.org, but you will hear more about the world's plan for immunization later today from our colleagues in global health. So those are kind of some dire statistics. And I just want to let you know why I still feel very optimistic, despite those numbers, and really energized by this work. And I'm going to do that by telling you a couple stories. So first, on the left is a family I was fortunate enough to meet. I was able to travel to the Democratic Republic of Congo in June with some colleagues. And thanks to UNICEF, I was able to meet Anne-Marie, that is the girl on the left, and her family. And Anne-Marie, UNICEF brought us to talk with Anne-Marie because when she was 1.5, her father noticed that she was having some weakness on her right side. And he took her right away to a clinic in DRC. And the clinic had been trained to recognize signs of polio. And they took a sample and they sent it off to a lab. In fact, it's in South Africa. And the sample came back as positive for polio. She was 1.5 years old. She was still relatively small at 1.5, so they were able to give her some physical therapy and some massage. And you can see she's a very active young girl. The boy to the right of the dad there is her twin brother, who, as her dad said, chases her around all the time. He's quite active. And Anne-Marie has had very few, she's weakness on her right side. But otherwise, she is a girl who loves school. She's very happy and she's thriving. And a lot of that is because her polio was detected quickly. They were also able to do what they call outreach to her community. They do ring immunization. So while she had a dose, she hadn't had her full course. So they made sure in the whole community that they protected all the children around her. And she and her family now are so committed to making sure that this doesn't happen to anybody else, that they met with us and really spent some time telling her story. So you do see the effects when there is a great infrastructure in place to be able to detect polio, to be able to, although we know there isn't really a cure, but to be able to get treatment of physical therapy and massage so that she can grow up and have a normal childhood. So people like Anne-Marie and her family, as well as the number of healthcare professionals I was able to meet in DRC. So whether it was, UNICEF that took us around, and they've been doing a lot, not only to provide vaccines, but to check in with communities. We met with many people from the Ministry of Health. We met with the doctor who first diagnosed Anne-Marie and who knew to take the sample right away, express it to South Africa so they could get the diagnosis back. These are people who are dedicated to making sure children do not die of infectious disease. And if any of you have been to DRC or heard stories about it, it is a really difficult place. These people are working in circumstances. In Kinshasa, where we visited, there are 17 million people. It is really, the circumstances are challenging to cover the amount of people these healthcare workers need to cover. They travel by foot, checking in on families, checking on vaccination status. They keep careful records. So if a child has missed a vaccination, they will go door to door and talk to them and ask why they missed, see if they can organize a catch up for that child. So people who are dedicated and working day in, day out in these really challenging circumstances give me a lot of hope for our being able to protect children around the world. Next, this picture is from Mongolia. And this is actually someone riding a caribou. That is a vaccine cooler, if you can believe it. So even in the most extreme weather conditions, they are making sure vaccines get to children, and that the cold chain, obviously not there. It's more of it's cold enough. You're hoping the vaccines don't freeze. But anyways, whether it's riding a camel in the desert, crossing a river in canoe, which we saw in DRC with these vaccine coolers, there are people who are incredibly dedicated. And it's those people that really help fuel me, and I think my team also, in the work that we do. And we hope by sharing more stories with you that this will help you stay motivated, because on the ground, tremendous work is being done. I have had the fortune to meet people in Haiti, Uganda, Laos, many other places. They're working every day, doing the work on the ground to ensure that children are protected. So when I think about those people, know that, and I want you to think about them too, your advocacy matters, because the funding from the US government that you're helping ensure is helping these people do their jobs. So all of this, as I said, gives me tremendous hope. Before I go over to the next video, I just wanted to reiterate what Rebecca said. We will be holding our summit in person. We hope many of you will join us. This will be late February or early March. And now I'd like to go over to a video that the team put together. Wow. Well, that video always inspires me. We are so lucky to have the champions we have. And for those of you who are new, you see you're joining a really great rank of dedicated people. So I hope you enjoyed that video. And this is the end of our welcome session.